Welcome everyone to our medication.lk YouTube channel. Today, let's talk about mammogram. What is mammogram? Why the mammograms are being done and how it is interpreted. Let's have an idea about mammogram. Today, through our medication.lk channel, we are going to educate you regarding mammogram. Let's talk about what is mammogram, its indications, how it is done, and how the reports are being interpreted. Indications for mammogram. Usually, mammograms are indicated in women who are over more than 40 years with some focal signs in the breast or following diagnosis of a breast cancer to exclude multifocal, multicentric, or bilateral disease. Then the patients who are having breast cancer who underwent a treatment for the follow-up. The mammograms are being done no more frequently than annually or no less frequently than biannually for at least 10 years. Then the population screening of asymptomatic women who are between 50 and 70 years of age, and it has been done in the interval of every 3 years. Mammograms are not indicated in asymptomatic women without family history of breast cancer and who are under 40 years of age. It also not indicated for generalized symptoms like cyclic mastalgia or just pain everywhere in the breast, or it is not indicated prior to the commencement of hormonal replacement therapy, and it is also not indicated for routine gynecomastia. How the mammograms are being done? Uh, Usually, we take two views, mediolateral oblique view and craniocaudal view, and additional techniques are there like lateral, mediolateral extended compression view, axillary tail, mediolateral or lateromedial views. When mammogram is being done, the breast is being compressed under two pedals. Why the breast is being compressed while doing a mammogram? It reduces the radiation dose, it immobilizes the breast, so reduce the blurring of the image, and there is a uniform breast thickness after compression that allows even penetration of the X-rays, and it reduces the breast thickness, thus reducing the scatter and noise, which are the artifacts of the mammogram. There are additional views like spot compression, where it is indicated to remove the overlapping of the composite of the tissue, and there are magnification views. If you see some abnormally small area, you can magnify and see it under mammogram. How you should prepare for a mammogram study? There is no particular preparations for mammogram, but you need to have clean breasts. If you are having some foreign things over your skin, like if you have applied talc or something, then it may cause artifacts over the image which can be wrongly interpreted. So your breast should be clean. This image shows how the mammogram is being taken. You can see the camera unit and you can see the X-ray beams are being going, and your breast is compressed under two pedals, and this is how the mammogram are being done. You may feel slight discomfort while compressing the breast, but it improves the quality of the study. This is another image which shows how the compression are being applied. This is our normal anatomy of our breast. You can see the skin, the fatty tissue, the blood vessels, and the mammary ducts, and how the lobules are being formed under your skin. This is how the breasts are being seen in mammogram. These are the mediolateral oblique views and the craniocaudal view. You can see the skin, the fatty tissue, the glandular tissue, the underlying muscles, the axilla, the nipple, subareolar area, everything. So if there is any abnormality, you can appreciate it in mammogram. Mammogram is followed by an ultrasound scan. Here is an image of an ultrasound scan. You can see the skin, the subcutaneous fat, then the glandular tissue, then underlying muscles, and the ribs, and even the pleura you can see in this ultrasound scan image. This is the mammogram machine. This is an digital mammogram machine. These are the pedals between which the breast is being compressed, and the X-rays are produced coming from above, and the cassette is there underneath the lower pedal, and these are the operating techniques. And you can see the operating table. The radiographer will operate the machine from being here in the table. It is covered by a lead glass. These are the mammogram images within the console. You can see we can manipulate the images, and we can appreciate, we can comment about its composition and its structure, and if any abnormality we can comment on that. We can manipulate the images by enlarging, by changing the sides, and by inverting the images, and reducing the window sequences as well. This is an ultrasound image of the breast. Uh, we can appreciate the skin, the subcutaneous tissue, the underlying breast fatty tissue, the glandular tissue, the nipple, and its composition. Here you can see an abnormal area which shows an irregular hypoechoic area with posterior acoustic shadowing, which is an suspicious lesion in the breast. This mammogram image shows an abnormality. Here you can see a large, irregular, hyperdense lesion. We can magnify the image and see with calcifications and distorting the architecture, which is an abnormal area of the breast with suspicious lesion. We will meet in another day with another health advices. Thank you.